We want to remind our listeners that this program is for informational and educational purposes only and not intended to substitute for professional veterinary and medical advice, diagnosis, or treatment. The Animal Medical Center does not recommend or endorse any products or services advertised by Sirius XM.
Welcome to Ask the Vet with Dr. Ann Hohenhaus. This is the place to talk about your pets and get advice with a top veterinarian from the Animal Medical Center in NYC. Hear from the leading authorities on animals and give us a call to ask your questions. Now, here's your host, Dr. Ann Hohenhaus.
Hi, everyone. And thanks for joining me today on Ask the Vet. We've got a great show for you today. I'm your host, Dr. Ann Hohenhaus. I'm a board-certified internist and oncologist at the Schwarzman Animal Medical Center right here in New York City, and we are the world's largest not-for-profit animal hospital. At the Animal Medical Center, we keep families together. And how do we do that? We provide the absolute best care for pets, and we've been doing it for over 110 years. Keep in mind that Ask the Vet is also available as a podcast, thanks to our partnership with Sirius XM Radio. So if your friends don't get Sirius XM Radio, they can like and follow our show just by going to their favorite podcast platform and downloading the Ask the Vet podcast app. It'll keep you up to date on the latest news from the Schwarzman Animal Medical Center and also news about animals. Now, later in the show, I'm going to answer your questions about pet health. So if you have a question about your pet's health, you can call and leave me a voicemail message on our toll-free voicemail line. I'll answer your questions on next month's Ask the Vet program. I'll give the number now, but if you don't have a pen or pencil, you can take down the number, which I'll give again a couple more times during the show. The number to call Ask the Vet's toll-free phone line is 866-993-8267. And don't forget to get a pen and pencil during the break if you didn't copy that down. And now it's time for our trending animal of the month. This month's trending animal is kind of a new version of an old story. If you remember, we've talked about Fiona the hippo, the little preemie hippo that was born in Cincinnati Zoo about 5 years ago. Well, now Fiona is a big sister to a little brother named Fritz. Fritz was the winning name in a worldwide contest to name the new baby hippo. I don't think any of us will forget Fiona. The Cincinnati Zoo hippo shot to worldwide fame in 2017 when she was born 6 weeks premature. Fans kept a close eye on her ever since, and this cheeky little hippo has over 90,000 followers on her website. The new hippo, Fritz, was a little bit of a surprise hippo because Fritz's mother, Bibi, was supposed to be on birth control and wasn't supposed to have any more baby hippos. But all of a sudden, there was Fritz. Fritz was the winning name, but the other name, which I think is not nearly as good as Fritz, was Ferguson. And Fritz won with 56% of people voting for Fritz over Ferguson. And Wendy Rice, the head hippo keeper at the Cincinnati Zoo, said in a news release, "We would have been happy with either name, but we really think Fritz fits this spunky little guy's personality." Fiona is now 5 and is a proud big sister. And you can see Fiona and Fritz meeting for the first time by simply Googling Fiona and Fritz, and you'll see a video of the pair of little hippos getting to know each other. Just get out a tissue or two because it's really a tearjerker. So just to change things up a little bit today, I'm going to ask a question, which I'll answer a little bit later in the show. And my question for you is, what is a group of hippos called? The answer, after we talk with my guest today, who's going to talk about artificial intelligence and X-rays. Today's guest is my colleague at the Schwarzman Animal Medical Center and AMC's newest senior veterinarian, Dr. Eunbee Kim. Dr. Kim recently completed her residency in diagnostic imaging. And that's like the fancy name for people who do x-rays and ultrasounds and CT scans and MRIs. Because just to say they do x-rays is really underestimating what these folks do. So after completing her residency in diagnostic imaging, she joined the AMC staff. Recently, she's published some very interesting research on artificial intelligence in veterinary medicine, specifically interpretation of x-rays. And I wanted to have her on our show to talk more about this. It feels like everybody talks about artificial intelligence, and so I'm really interested in learning more about this topic. Dr. Kim, thanks so much for joining us today.
Thank you for having me.
So, you recently completed your residency and joined our staff, and deserve a big congratulations for that, because it's a huge achievement. So can you tell people a little bit how you chose to specialize in diagnostic imaging, which most people would think more about as radiology, but I'm not sure when I was thinking about being a veterinarian that I even would have ever even considered that. So how'd you even learn about diagnostic imaging?
Yeah, that's a great question. I think that I knew I wanted to be in a specialty that touched on all fields in veterinary medicine, and diagnostic imaging or radiology is kind of at the cornerstone of a lot of things we do. It's a huge diagnostic necessity. And to the untrained eye, maybe they just see an x-ray, but to someone that's gone through residency and trained radiologist, they can get a lot of information that maybe people don't see. So I think that being able to extract information from x-rays, from MR is extremely helpful, both for the patient and the client.
So explain a little bit what you mean that radiology does all species.
Yeah, so we certainly do have to train in all species. So on the board exam, I had to know things from alpacas to horses to birds and bunnies and all sorts of little creatures that we don't necessarily see every day at the AMC. But also, I just love that, we're involved in every single specialty in our hospital, whether it's a dog that ate a corn cob and now we need to take x-rays for emergency, or there's a cat that came in for seizures and we need to MRI it to check for a brain tumor. So it's something that is necessary in all of our specialties.
So speaking of corn cobs, did you see the accidental MRI of the corn cob a couple weeks ago?
Yeah, I did. I saw that post.
It's just great. There's this dog who was getting an MRI, which I think it had a back problem or something. And then, the stomach is close enough to the back that the MRI picked up the fact the dog had a corn cob sitting in his stomach. It's one of the all-time best MRIs ever. It's this big zigzag thing in the dog's stomach. You're like, what is that? And it's a corn cob. And for listeners out there, please keep the corn cobs away from dogs, because Dr. Eunbee's team spends a lot of time figuring out if your dog ate a corn cob. The medicine and surgery team spend a lot of time fishing corn cobs out of animals. And it's really hard because they don't show up very well on x-rays.
Yeah, it can hide a little bit, but I feel like people think it's kind of a harmless little snack, but they really get stuck in there.
Oh yeah, they're terrible. Corn cobs are really just absolutely awful. There yesterday, did you see the Ethernet cord? Some dog ate an Ethernet cord.
Yeah, I just saw that this morning. I saw that they were retaking the x-ray to make sure it was still there before taking it out.
They fished it out of the dog, but pets will eat almost anything. And radiology probably has a great collection of crazy things. What's your best x-ray that you have saved?
We've seen a lot of AirPods recently. That's kind of a 21st century foreign body, probably. Air tags. I love when we find money in there and I can actually count. I can tell what type of coin it is, and I can count the number of cents in this patient's stomach. All sorts of clothes, underwear, socks, you name it.
Yeah, I had an x-ray that you could see Lincoln's head. You knew it was a penny because the x-ray was good enough that Lincoln's head kind of stood out, and you knew it wasn't a quarter because it didn't have that ridgy edge
Yeah, the little zigzag.
on the coin. So keep your houses picked up, people, because we would rather not have to fish things out of your pets. Okay, back to radiology. Some people think that radiologists spend all day sitting in the dark wearing bunny slippers. Is that really what you do?
I definitely don't wear bunny slippers, but I certainly sit in a dark room looking at images most of the time, unless we're, actively involved in obtaining the X-ray or scanning for the ultrasound, or involved with tissue sampling, fine needle aspirates, or biopsying patients. But the majority of our time, yes, is spent sitting at a chair, sitting at a desk, and looking at the images and trying to figure out what we're looking at so that we can relay to our staff doctors who have signed up the imaging what the problem is, what next steps there are, things like that.
So why sit in the dark?
Well, we have
your eyes don't work when it's light outside?
I mean, they certainly do, but all of our images are a shade of gray, from, black and white, and our human eye can only see so many shades of gray. So we try to help that out by creating the best environment possible, which is a dark room.
So let's shift a little bit and talk about your resident project, which was published in the Journal of Veterinary Radiology, which, interesting, that journal was named a long time ago. So it's still veterinary radiology and ultrasound, although you do a whole lot more than that. So talk about the artificial intelligence project.
Sure. So our project that we did, it was comparing a specific artificial intelligence company's ability to diagnose left-sided congestive heart failure in dogs compared to a board-certified radiologist.
Okay, so you have to translate a little bit. What should the pet owner with left-sided congestive heart failure be?
So left-sided congestive heart failure is basically when there's a valve in your heart, and it's the most common disease that we see in our canine patients. It's called degenerative mitral valve disease. I'm sure people listening with a small dog probably have heard about it. If your small dog is a little bit older and has a heart murmur, it likely has degenerative mitral valve disease. And basically the valve, it gets a little leaky because it's just getting a little older, a little bit thickened. And so instead of being able to completely push all the blood through the heart in one direction, when it pumps, some of it leaks backwards. And as it leaks backwards, the fluid goes into the lung, causing congestive heart failure. And that fluid in the lung can be seen, that can be detected on an X-ray.
And so these are dogs that come into the ER for coughing and breathing fast, and then ER signs up a chest X-ray, and then you and your artificial intelligence system said, who's better, me or the computer, at figuring out if these dogs have pulmonary edema or fluid on the lungs from congestive heart failure.
Yeah, and maybe not who's better, but are they as good as board certified radiologists? Because we never compared to another gold standard, which might have been, did the dog get an echo to confirm that there was degenerative mitral valve disease or supportive signs, or did the dog also have another X-ray following therapy to see if the fluid in the lungs went away? But really to see, okay, this is what the board certified radiologist thought. Does the AI software agree, or do they think it's something else?
And how good did it do?
Honestly, it did really well. So I would, out of our study, we were able to say that the AI agreed with the board certified radiologist in 9 out of 10 cases of congestive heart failure in our dogs. And that's out of 5.
So your first comment about AI, you said we used a particular company's artificial intelligence system. Tell our listeners why you made that specific comment, because that was not an accidental choice of
No,
words.
yeah. So at this point, there are certainly a number of different AI companies out there, both in human medicine and in veterinary medicine. The one that we chose, we have no financial connection to. We just know that the way that they've trained, they really strive to train their AI algorithm with best practices, gold standards. So we knew that they wanted to work with us in a specific disease, whereas maybe other companies might approach it in kind of an all-in-one method where they try to just see what the AI system can do in one X-ray, find all the problems that are possible. So we did like that the way that it was trained, and we liked that it was a commercially available software that was out there that was being used, because none of our cases in our research they were flagged as research. So this just went straight through the AI, and the AI had no idea that it was part of a study. It just thought of it as another patient.
So why would this even matter? But we have nice radiologists like you and the rest of the radiology team to look at our x-rays. So why was this an important study to conduct?
So in our study, we actually were very narrow about our parameters, and we looked at a specific population between the times of 6 p.m. and 8 a.m. So we made it very specific because during those times, most people have gone home, and really you only have an ER doctor that's looking at the x-rays. And yes, you can see the fluid in the lungs from heart failure if it's obvious, but many times it can be very, very difficult or very subtle. So we wanted to know, in the absence of a board certified radiologist, or if there are people working out in the field who don't have access to a radiology service, could this AI system actually be helpful? Could it say, hey, you know what, this is actually very concerning. Maybe you should treat for the heart failure and then recheck, instead of just saying, okay, I think we're safe. We don't have to do anything here.
And that's really the key, is hoping that we can use this AI to help more animals who don't have access to a radiologist in the middle of the night. And that's helpful not just to animals here at AMC, but potentially helpful elsewhere. So if I was a Joe neighborhood veterinarian, could I buy this, or how would I use this piece of?
Yeah,
it's not really equipment. It's like a box somewhere.
I think it depends on the company. I know that the company that we used, basically it's just a service where it's all, cloud-based, and you submit your study electronically. It goes through the AI, and pretty much within minutes you'll have a response back.
So it could be used by someone because this is currently commercially available.
Correct.
So that sounds like good things about AI, but are there any limits to what AI can do?
Yeah, certainly. There's limits to everything, but I think that, first of all, I think it's important to know that AI is still in its infancy in veterinary medicine. There's only a handful of papers and research that have looked into the possibility of AI. We've only really dipped our toe into this AI pool so far. Compared to in human medicine, there's tons of studies out there, and even within the studies, they have thousands and thousands of patients that are participating in these studies. So I think that's, first of all, very important to know that we are kind of at the forefront of it in veterinary medicine. So at this point, we're really just proving, is it even possible in our field? Another limitation is that in human medicine, they have the FDA, the Food and Drug Administration, that will approve these specific AI systems. And they'll say, okay, is this AI software claims that it can see abnormalities in breast tissue on mammograms, and approve it so that it can actually be used by radiologists. We personally, as veterinarians, we don't have an overseeing body. So that I think is kind of a limitation, because we're not sure. which company to trust and which company to choose. None of them are being vetted at this point. So to me, it's hard to really kind of back a company or support a company because we don't have the full governing body that really approves what's going on.
So do you think AI is going to be widely adopted for radiographs in the US?
I think in human medicine, we are certainly approaching the point where AI is and will be used. I think that we're still trying to fine tune the exact role of AI because, for a long time, people were afraid, is AI going to replace us? Is AI going to replace the radiologist? And I think that the conversation is now more, how can we use it so that we can actually truly revolutionize the industry? As far as veterinary medicine, I think that there are certainly many different ways that it can be applied and utilized to really help us in our efficiency and accuracy. As at AMC alone, we've seen a huge increase in caseload. So that means that, our clinicians have longer wait times for turnaround times to receive reports, or we're having to go through many more images for certain studies. And maybe in the future, AI could help say, hey, this abnormality is a little bit weird and we need a board certified radiologist's eyes to actually look at it, to assess it, to determine in the scheme of the whole clinical case, is it important or not?
So do you think that you've got another project that you're going to do related to this?
You know what? I think that there are certainly many different options, not even related to my project. There could be many other diseases or species or modalities, even, not just X-ray. Can we apply it to ultrasound, or, in other services, can we apply it to clinical pathology? Can AI detect whether something is cancer or not in the cells that we pull from our patients? I certainly think there's a lot of research to be done in the field.
I actually think that there's a smidge of AI going on because there is a clinical pathology box, a piece of equipment that will look at a urine sample sediment, not just, does it have sugar in it or does it have a pH of 7, but it'll actually look at the cells and things that are in the urine and automatically scan a sediment of a urine, so and tell you what it is. So I think there are some. Now, I don't think that's a high precision machine, but I think it's the beginnings of exactly what you're talking about at this point, that this AI is going to change some of the things we do and maybe free up veterinarians to provide more actual patient care and thinking about patients rather than doing tasks like looking at X-rays or looking at a microscope slide. So what's your final takeaway from this whole AI situation?
Well, I guess I can leave you with a quote. So there's a radiologist from Stanford who says that radiologists who use AI will replace radiologists who don't. So to me, I think it's something that we as veterinarians and veterinary radiologists should embrace and really take on the responsibility to figure out the best way to use it that's best for our clients, our patients, and for us.
I think that is a terrific quote to end on. I want to thank Dr. Eunbee Kim, AMC's newest senior veterinarian and radiologist, author of, why don't you give us the title of your paper?
Sure. The title is Comparison of Artificial Intelligence to the Veterinary Radiologist Diagnosis of Canine Cardiogenic Pulmonary Edema.
And so it is a great paper. I've read it myself. And I just want all of you to know that someday there'll be some sort of artificial intelligence that might be reading your pet's x-rays too. Thanks for joining us today. And before we go on a break, I want to do a couple of things. First, I'd like to answer my own question. What is a group of hippos called? A group of hippos is called a hippo bloat, B-L-O-A-T. Can't imagine where that came from. Don't forget, if you have a question about your pet's health, call and leave us a message on our toll-free voicemail, and I'll answer your pet health questions on next month's Ask the Vet. The number is 866-993-8267. Are you ready for this month's animal news? We've got a bunch of great stories today. First of all, police caught a wild turkey breaking and entering in Wisconsin. That's right, police body cameras caught a wild turkey after it broke into a vacant apartment. Somehow the turkey climbed through a second-story window. A local officer kindly went in and rescued the turkey, who then was, of course, trapped in this apartment because turkeys can't open doors, and brought her back outside safely. Happy ending to this gobble gobble story. This story is a pretty amazing one. Our second story is about endangered sea turtles. There's a group of endangered sea turtles found on a Louisiana island for the first time in 75 years. These are Kemp's Ridley sea turtles. They're the world's smallest sea turtle species, and they were discovered on Chandeleur Island off the coast of New Orleans. Wildlife experts documented more than 53 turtle crawls and 2 live hatchlings navigating towards the sea. This is huge news for environmentalists who had feared the end of this endangered species. This particular area near New Orleans was hit badly by the BP oil spill and by hurricanes in recent years. But Louisiana is hoping that their efforts are paying off in restoring more animal wildlife habitats. So good news about the Ridley's sea turtles. Our third story is a dog story. There were reports of unidentified illnesses killing dogs in Michigan. And at that, the initial reports, veterinarians weren't really sure what it was. But the dogs who were infected were under 2 years of age and were suffering from vomiting and diarrhea. Well, turns out the disease isn't so mysterious at all. The disease is Canine Parvovirus, and that's a disease that's been around since the mid-1970s and affects dogs who are not vaccinated against parvovirus. What is mysterious about this situation in Michigan is that the clinic tests that veterinarians like our emergency room at the Schwarzman Animal Medical Center rely on for rapid diagnosis doesn't seem to be picking up these cases in Michigan. And Michigan officials are working hard to try and determine why this test is not working in the dogs there, because it hampers our ability to diagnose and then correctly treat these dogs when they develop parvovirus. This outbreak in Michigan was really big. There were over 20 dogs in Otsego County, Michigan, that died from parvovirus, some within a few days of developing typical parvovirus symptoms of vomiting, diarrhea, and bloody stool. What's most important about this story is that dog owners should keep in mind that parvovirus is a preventable disease and simply preventable with vaccination. The catch is that a puppy needs its final booster after the age of 16 weeks of age, and then again a year later, and probably then every 3 years after that. Most of the dogs affected had been inadequately vaccinated, according to Michigan state veterinary health officials. So please, everyone, check your vaccination records with your veterinarian and be sure that your dog is vaccinated so that it couldn't end up getting this terrible disease. And our final story today is information from a new study about dogs and doggy dementia. So dogs, like people as they age, develop cognitive dysfunction. That's what we call it in dogs, because dementia is a very specific human diagnosis. And dogs that reach 10 years of age, their risk increases 50% each year of developing dementia. University of Washington scientists found that dogs with dementia can experience learning and memory challenges, loss of spatial awareness, meaning they get stuck in corners and don't realize they're in a corner, and altered interactions with their family and other dogs. They also have disrupted sleep patterns, and these dogs often pace around at night and sleep all day. So if you're a dog owner, you should be on the lookout for these kinds of signs as your dog ages. Both mental activity, like engaging with your pet and doing things with them, as well as exercise, are important for your dog's mental well-being and may also reduce your dog's risk of developing canine cognitive dysfunction. This recent research paper shows that inactive dogs were 6.5 times more likely to be diagnosed with cognitive dysfunction, according to the study. So that means everybody should be out with their dogs, walking and hiking and throwing the ball in order to keep them both physically and mentally fit. Now, I want to tell you a little bit about the place that I work, the Schwarzman Animal Medical Center. We started as a temporary clinic 112 years ago to provide veterinary care to animals whose owners couldn't afford it. Today, AMC continues to give back to the community. In 2021, the Schwarzman Animal Medical Center donated nearly $5 million in veterinary care through our 13 charitable funds, which help pets in need. AMC's 120 plus veterinarians and 43 board certified specialists work together over 20 specialties in service to manage nearly 60,000 individual patient visits each year. Simply stated, about 160 pets come through AMC's doors every day. Now, don't forget, if you have a pet health question, just call and leave me a message. It's that simple. And I'll answer your questions on next month's Ask the Vet. The number to call is 866-993-8267. And don't forget to check us out on social media. Facebook, it's The Animal Medical Center, and Instagram and Twitter, it's AMCNY. And now it's time to go to calls from our listeners. Our first call today comes from Diana in LA.
Hi, my name is Christina Hernandez, and I'm from Belleville, Illinois, and I was just calling with a question about my puppy's nausea. She gets severely car sick within the first 2-3 minutes of being in the car, and I didn't know if you had any recommendations to help ease her nausea and her car sickness. Thank you. Bye-bye.
Oops, so that wasn't Diana from LA, but that was Christina from Illinois. However, Christina from Illinois, I hope you're listening, because you're going to be so happy with what I have to say. First of all, most puppies outgrow car sickness, so there's a light at the end of the tunnel. I don't understand why puppies are so car sick and then dogs seem to be fine. The second thing is there's something you can do now. There is a medication called Mirapatent. Its brand name is called Serenia, and is specifically made for puppies with car sickness. So you give a pill or a portion of a pill or 2 pills, depending on the size of your puppy, and you give that puppy the Serenia about an hour before the car ride, and the puppy feels much, much better because the medication is really effective, and it helps stop all that drooling and foam that gets all over the car seats and the doors and the windows and everything. And so this puppy is going to be so happy when it gets to go on a car ride and doesn't want to throw up. And Christina from Illinois is going to be so happy because she's not going to have to clean up dog throw up in the car. So Christina, there's something you can do. You need to go see your veterinarian because this medicine is available only by prescription, but I can't imagine there's any veterinarian that doesn't have this really great drug. Thanks for the call. And Christina, I'm sure you've helped other people make their puppies better too. Now, I think we're going to have Diana from LA.
Hi, this is Diana from Los Angeles calling about my golden doodle, age 7 years old, for At the Vet. And the dog only at night starts to pant and appears to be anxious. And I wanted to know if, in fact, that is a possible diagnosis, like almost what senior citizens get when they're older, when they have issues with nighttime. So anyway, just wanted to know if there's something to be done for that. Dog is 7 years old, in perfect health other than that. Thanks.
So, Diana, your question is perfectly timed with one of our news stories for today, which suggests that, yes, in fact, dogs do get cognitive dysfunction, or kind of the dog version of senior citizens' dementia issues. And you're right, nighttime wakefulness is something that might indicate cognitive dysfunction. The challenge for me is that the a 7-year-old dog seems kind of young to be developing cognitive dysfunction. I think it's possible, but I think there are other things to think about. So keep in mind that dogs pant because they are too hot. So is your dog too hot at night? There are things you can do, like a cooling blanket that draws the heat away from your dog. They make cooling mattresses for people, same kind of concept. So you need to cool your dog off or have a fan on so the dog can lay in front of it. Dogs will also pant if they're painful. So a 7-year-old golden doodle, I'm going to assume, is a large breed dog, and 7 years old is not too young to be developing signs of arthritis. So I think it's possible that you have a dog who's painful at night and is panting because it's uncomfortable. So that is my second suggestion. And my third suggestion is that some dogs are anxious at night, maybe because of cognitive dysfunction, or maybe something else is going on in the household or in the neighborhood at night that's got the dog worked up. So I think that right now, a trip to the veterinarian would be a really good idea, to have the golden doodle evaluated for things that cause panting, like the dog is too hot, the dog is anxious, or the dog is painful in some way. And a good workup by your veterinarian should help to identify why your golden doodle is panting at night. But I think there's probably something wrong. Hope this is helpful. And Diana, call back and let us know how the doodle is doing. And our final caller today is Felix the cat.
Hello. I have a cat, Felix, about 10 years old, and occasionally he gets down on the floor, close to the floor, and he does this loud hacking cough. It'll happen like 4 or 5 times, then he quits. But we pat him on the back, and the vet says she doesn't know what it is. His lungs seem good, but he's a indoor-outdoor cat, so I'm sure he eats wild mice and things like that.
So Felix the cat's owner is right to worry that Felix's time outdoors might be the cause of his cough. Cats that eat mice are at risk for a disease called toxoplasmosis, which is carried by mice. And then when the cat eats the mouse, we have disease in the lungs. So toxoplasmosis is one possible thing. Cats that live outdoors are at risk for heartworm disease. And most of us think about heartworm disease in dogs, but cats are at risk, especially those that go outdoors. So that heartworm disease will cause coughing in cats. And so will a parasite called lungworms. Lungworms invade into the lungs and cause coughing. There are also other causes of coughing in cats, like asthma, pneumonia, and depending on where in the country Felix the cat lives, there are fungal infections in the lungs that can cause coughing. So if Felix the cat was my patient, I would start by getting a chest x-ray on Felix the cat and see if I could see something there, because it sure sounds like the problem in Felix is in Felix's lungs. And it might also take some additional testing of a fecal sample to identify things like parasitic infections, or a blood sample to identify heartworms circulating in Felix's bloodstream. So I hope that Felix's cat's owner has a good veterinarian who's willing to work with this list of possibilities, but I think there's definitely something wrong with Felix. So when we come back from our second break, we're going to talk about the news from the Animal Medical Center. And don't forget, if you want your questions answered on next month's show, the number to call our toll-free voicemail is 866-993-8267. For pet parents everywhere, if you're looking for the most accurate, trustworthy pet health information, look no further than AMC's Eusdan Institute for Animal Health Education. The Eusdan Institute's free pet health library is the leading online user-friendly platform with all its content verified by the veterinary experts at the Schwarzman Animal Medical Center. Every month, the Eusdan Institute also presents free virtual pet health events and publishes a weekly newsletter packed with timely pet health information. Pet parents can stream all prior Eusdan pet health events, as well as AMC's Animal Lovers Book Club videos, and they live on AMC's website. To view any of these events, you only need to go to www.amcny.org/Eusdan events. Registration for all the Eusdan events is free, but of course it's required because we can't send you the Zoom link if we don't have your registration and email. To find out more about the Eusdan events, visit AMC's webpage, which is amcny.org, and you can just put events in the search bar. I want to thank Dr. Eunbee Kim for such an interesting conversation about artificial intelligence in veterinary medicine. And as always, thanks to all my listeners and callers, and to everyone who's downloaded the Ask the Vet podcast. We appreciate your support. If you haven't downloaded the podcast yet, you only need to go to any podcast platform and search for Ask the Vet podcast, and you can listen too. Don't forget, if you have a question about your pet's health, just call and leave me a message. Our toll-free number is 866-993-8267. And just a heads up, our next month's guest will be Dr. Lisa Weith. She is a board-certified veterinary nutritionist. So call and leave some pet diet and food-related questions, and I'll see if I can get her to answer those questions for us. We hope you'll check us out on social media. Remember, on Facebook, it's the Animal Medical Center. On Twitter, it's AMCNY, and Instagram, AMCNY. Be sure to like and subscribe where you listen to your podcast to get the new episodes of Ask the Vet. And I'll be back here next month on Ask the Vet here on Sirius Stars channel 109. Have a great month, everyone, and thanks so much for listening.